Hi everyone, I'm Tammie Culley. I have been doing massage for approximately 10 years now. I started out not even thinking about structure as structural bodywork as my specialty. It just kind of came to me as I started working and with more clients. I found that most of them were coming to me with postural issues, structural things going on. So as I started to study and I worked with other therapists and asked questions, I found that most people really didn't understand structural work. They really didn't understand how to really look at the body and assess what's going on. Also, I found that most people had no clue how to interview. And that's why I'm doing this class. I think it's super important that we as therapists understand how to ask questions and glean information and utilize that information while we're watching our clients move so that we can better understand what's going on. In this workshop, we are going to really focus on assessment skills, and that being interviewing appropriately. Most of the things, there's more to interviewing for structural work than just asking about medications and pressure and goals for the session. When people come to you for structural work, they are looking for something specific. And so the questions that you ask are going to have to be way more specific. So we are going to do interviewing. We're going to also incorporate observation while we watch our clients move, and then we're also going to palpate. In the interviewing portion of your massage, you really need to get your hands on them as soon as possible. Also, a way to help narrow things down is to use specialized orthopedic assessment testing so that you can narrow down the area of the body that is causing most discomfort. So we're going to utilize this HOPS method, and we're going to work with each other to learn how to watch the body and see where those restrictions are. It's a mystery. We're going to be detectives. It's going to be a lot of fun to debunk those mysteries together. So let me give you an example of a little bit of structural assessment. This particular client and I have had an interview already, and we already talked about the fact that she's an office worker and that she had an injury to her foot a few months back, so she's been wearing a boot. She's now out of the boot, so we're going to look and see what's going on. Go ahead and turn and face that way. The first thing we want to do is just get an overall idea of what's going on with the client. Normally the ear should be above the shoulder to the hip, and then we want the joint here at the knee to be aligned too. And we notice that as we move down, that she's got a lot of hyperextension in the knee here. If we continue on down, it does go straight through the ankle bone. So we see that there is a little bit of hyperextension in the legs. So the next thing I'm going to do is have her turn to face the wall to her left, and she's going to walk away from us. What we're looking for here is her stride to see what's going on. Go ahead and turn around and walk back. If you notice, that foot is laterally rotated a little bit. She's go ahead and go back to the wall, and then we're going to try that one more time. What we're looking to see is how is that boot and her injury affecting her stride. And you can see that this foot still points forward and this foot does go laterally to the right. So we are seeing that there is some soft tissue issues going on in that area that we can work to help realign that stride.